we need to find suspect cases. We need to find the people who have the virus, and we need to isolate those patients as quickly as possible. The physical distancing measures that are in place and the lockdowns separate everybody from everybody else. But what we really need to focus on is finding those who are sick, those who have the virus, and isolate them, find their contacts and isolate them. Because the danger right now with the lockdowns and with all the sort of physical distancing, and people are feeling this now, that's really putting pressure on the economy. It's putting pressure on the social system. If we don't put in place the strong measures, the strong public health measures now, when those restrictions, when those movement restrictions and lockdowns are lifted, the danger is that disease will jump back up. Yes. So it's not just about physical distancing. It's not just about locking down. We have to have the capacity to do that. In China and in Singapore, in Korea, they really focused on having that comprehensive strategy. So when they got the flames of the fire were pushed down through physical distancing or through lockdowns, they then went after the virus. They went looking for the virus. And we need to actively search for cases of the virus, and we need to test every single suspect case. And if any contacts are sick, we need to test them as well. We don't need to test everybody. We need to focus on testing those who may have the virus. At this stage, we have to focus on saving lives. But at the same time, we have to focus on trying to take the heat out of this epidemic, and we have to try and go after this virus. I know that sounds very difficult. It seems overwhelming as a big wave of infection spreads over, but it's been successfully done elsewhere. It takes courage and it takes determination, but we have to save the lives of those who are very sick and critically unwell, and we have to try and suppress the transmission of the virus. And once we've suppressed transmission, we have to go after the virus. We have to take the fight to the virus.